Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type that in the chat. At the bottom of your screen, you will see several features, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now, I'll introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Good morning, everybody. Thanks, Rachel. We're going to go ahead and get started now. Rachel, can you confirm, am I on the right screen?
You sure are. We can see everything perfectly.
Excellent. Thank you very much. So glad you folks could join us this Monday morning. Hope everybody had a great weekend. I don't know if anybody else is an OU fan, but I promise you my wife is, and it was a very loud evening at our house on Saturday night. The dogs and I stayed safely ensconced back in a safe room while my wife enjoyed the football game immensely. So wasn't very fun over here, but I'm glad we won. Okay, wanted to remind everybody that the Medicare Assistance Program is a grant-funded program through grants that we receive from the administration for community living. They allow us to go out and educate folks about Medicare and all the parts of Medicare, as well as what to do if you're having any problems with Medicare. So if you've got any issues or anything, please don't hesitate to give us a call. We would be happy to assist you. We also partner with multiple agencies around the state who also work with us to assist Oklahomans with their issues. Wanted to remind everybody, as if you might not remember, it's open enrollment right now. This is the time of year when we hope everybody is paying attention to their Medicare coverage and making decisions about making sure that the coverage that they've got is what they need for the coming year, that they don't have any gaps in their coverage. So we want to make sure that people are reviewing their coverage, looking for any gaps in terms of medication. Make sure that you're looking at making sure that your medication list, if you've got any new drugs, that those are covered. Make sure that the plan that you're on is covering all of your medications. Has any of your medications changed this year? Did the doctor change anything or add anything new? Maybe you've moved. Maybe you're not living in the same place. So we want to make sure that that doesn't impact any of your healthcare coverage. You're not living in the same service area or something like that. Have the benefits or the network of the plan that you're currently on changed in any way? If you're on maybe a Medicare Advantage plan, you should have received a document that is the annual notice of change. By the way, you would have gotten the same thing if you're on some kind of retirement plan. That document tells you if any changes have taken place. Be sure you're looking at that and noting any changes that might be important to you, because you want to note that. And if there's something that has changed that impacts you in a certain way, you want to identify that and look for anything that might give you that coverage back, that if it's something that's impacting you negatively. Has anything changed about your finances? Sometimes there's a financial impact and suddenly premiums are becoming an issue where maybe they weren't last year. So we want to make sure that your premiums that you're having to pay for your insurance aren't in some way a barrier to you being able to afford food and your other expenses like rent and stuff. So we want to make sure that that's not a problem as well. And sometimes it's just a good idea to know what your options are and what your coverage options. A lot of times we have a tendency sometimes to treat our health insurance like we do all of our other coverage, which you should never do, by the way. You should always be reviewing all of your insurance coverage, whether it's your homeowner's coverage, your car insurance, etc. But a lot of times we don't do that. And it's always a good idea to review your coverage and make sure you're getting the best coverage for the best possible price. First thing I wanted to touch base on today was to make sure everybody is aware and make sure that you're out there sharing this information in case anybody has missed it. They did come out with the cost of living increase for 2026 on Social Security. That cost of living increase is going to be 2.8%. On average, that increase is going to be approximately around $56 per person. Not everybody will be that. That's the average across the country. Some people it'll be less, some people it'll be more. Now we know that the Part B monthly premium is estimated to go up to approximately $206.50. It hasn't been officially announced yet, but that's the amount that came out in the Medicare trustee report. So that's going to be an increase of about $21.50. So that's going to eat into some of that $51 increase. So not a huge increase, but wanted folks to be aware of that. Okay, our topic for today is Medicare Part C, the Advantage plans. And we're going to talk some about what those plans are, but we're also going to talk quite a bit about the things that you need to be thinking about when you're talking about Medicare Advantage plans. These are plans that are contracted with Medicare. They're offered by private insurance companies. They have to cover everything that Medicare covers, but they oftentimes will offer more benefits that aren't covered by Medicare, things like dental and vision and hearing. And you've probably heard this information before. There's different models of Medicare Advantage plans that are available. And for most people, we've been around for a while now that we're familiar with these different options. We've been working in the work environment long enough that we probably worked for a company that might have had a health maintenance organization or an HMO or a PPO, a preferred provider organization. So you're somewhat familiar with what managed care looks like. So we're going to touch base on them some, but then we're going to spend a little bit more time on what are the things that you need to be thinking about. So first one we're going to talk about, health maintenance organization. This is the one that probably was the precursor. This is where everything kind of started. A health maintenance organization, or an HMO, has a contracted provider network. That's where they've got all the physicians, the hospitals, the specialists, the physical therapy providers. All of those guys are contracted directly with that company to provide the care for the people that are enrolled in that plan. And you're required to receive your services from the people that are contracted with that plan. And if you go outside of that network, you might find yourself in a situation where you're having to pay 100% of those costs. The way those companies are developed, the way that they are structured, is they manage the costs for the care by having you go to those contracted providers. They have negotiated contracts with those providers to try to save money. And so if you go outside of that network to a different provider that isn't contracted, then you could find yourself having to pay 100% of those costs. So in exchange for those extra benefits and things like that, and the lower costs and stuff, you're agreeing to use that contracted network. So you have to understand what some of those rules are that you're agreeing to before you get into those plans. Most of these health maintenance organizations have a zero monthly premium. Some of them don't. Some of them have a monthly premium, and it's typically because they may cover some more expensive drugs or some other benefits like that. So things to consider before you get enrolled in a health maintenance organization is, are the doctors, the hospitals, specialists, anybody that is really critical to your care, are they an actual contracted provider with that specific HMO? that means that that provider is actually contracted in the network and that they're going to accept that HMO when you go to them. That means that that provider has a contract, that they've got an accepted rate, that you're not going to have to pay out of network charges, that they're going to accept referrals from that HMO. They are actually part of the network. Oftentimes, when people we'll get to that when we talk about PPOs. Also, you want to make sure that all of your prescription medications are covered by the plan. The most of the health maintenance organizations, most of these HMOs also offer the prescription drug coverage, and that's great. And they do it for a 0 monthly premium, which can save you money. However, it's still critical that you make sure that all of your drugs are on the formulary for that plan. It's a waste of money if you go for it just because it's a 0 monthly premium and some of your meds aren't on the formulary. What was the point of doing it then? So always want to make sure all your drugs are covered on there. Are you willing to follow the plan's rules? In other words, if the plan says before you get that MRI, you have to get a referral, and that means your primary care doctor has to fill out this referral paperwork and it has to come into us and we have to approve it. Or before you get that surgery, we have to get a referral and it has to go within the network for our network providers, et cetera, et cetera. So you have to be willing to follow the plan's rules. So that includes getting a primary care physician. That's going to be kind of the gatekeeper for your care. Getting those prior authorizations, using the network of providers that they've contracted with. So that's another reason why it's very important that you identify who is the network of providers. If you want to make sure that you can use the network of providers at a specific hospital, such as Mercy or St. John's or something like that, then you want to see who they're contracted with first. Also, be sure that you know the rules of that specific plan. Not every company has the same rules. And even between the plans within a company, the rules can be different. One specific HMO plan within one carrier might allow you to get certain things done without a referral or with an automatic referral, and another one won't. Get the specifics about the plan that you're interested in and make sure that you understand them and that they're in writing. Now, I want to jump back to the top of this slide real quick because I want to talk more about the provider networks. One of the challenges that people have had in the past is identifying who is in this contracted network. As of this year, CMS does require that all of the plans that are out there, whether it's an HMO, a PPO, whatever, that they identify to CMS who their contracted network is. And that information is now available on the tool that we use when we're comparing plans on Medicare.gov, that tool that we refer to as Plan Finder. So when we're looking on Plan Finder, we can actually enter the doctors that you need to see. If there's a certain cardiologist or a pulmonologist, neurologist, whatever kind of doctor it is, if you've got the name of that doctor, we can enter that information and see if they are in fact contracted with that network. I think we can enter up to as many as like 5 or 6 doctors to see if they're contracted with that provider. And they don't even all have to be at the same hospital. It's going to go by the provider's name. So that's really kind of useful for us to be able to do that. Now, that being said, I will tell you, I strongly recommend that even if Plan Finder shows that they're contracted with that particular HMO or PPO or whatever the case may be, I still think it's a good idea to have a conversation with that provider's office and just confirm for your own peace of mind that they are in fact contracted as part of that network. The other thing to keep in mind is, do you travel frequently outside of that planned service area? Now, this can get kind of tricky with some of the plans nowadays because we know for a fact that some of these HMOs and PPOs have expanded their what they refer to as their service area. On some of these plans, they will allow you to go to any contracted provider anywhere in the country. So it doesn't matter if you're enrolled here in Oklahoma or South Dakota or wherever. If you're traveling somewhere in the United States, they might allow you to see any contracted provider anywhere in the country. But another HMO or another PPO may not. They may say, nope, you've got to stay within this service area. So make sure you understand the rules of your specific HMO or PPO. Now, there's a version of an HMO that's called an HMO point of service plan. It works like an HMO in that you've got a primary care physician. There's also going to be a contracted network. You're going to have referrals, but you do have the option of going out of network. That's that point of service option. If you use the point of service option, you can see an out of network provider. Typically, you're going to have higher out of pocket costs. You may even have a deductible, and in some situations, you may even be responsible for having to file the claims. So if you look at one of those, if you see an HMO point of service plan and you're interested in it, I would still strongly recommend that for those services that you seek the most often, it's a good idea to make sure that those providers are contracted with that HMO. You don't want to use that point of service option for the services that you know you're going to be using a lot. Now, moving on to the preferred provider organization, this is a little less restricted than the HMO in that there's a contracted network and there is a service area, but you can seek care outside of that network. The plan's still going to pay, but it's going to pay considerably less. Typically, you're going to have a deductible, and then the plan's going to pay a percentage of the allowable charges. Now, I put that in there as allowable because I want to make sure that people understand the plan, the PPO, is going to have their own fee schedule, and it's going to pay a percentage of that allowable fee schedule, not the total charges, the allowable fee schedule. So if that particular provider that you went to out of network has a fee schedule that has higher charges, your PPO plan may only pay a percentage of their allowable charges. So make sure you understand that. Sometimes the monthly premiums can be higher on HMO than the HMOs, but most of the time we don't really see that. Where we see the differences come in is going to be on the user side when you're actually using benefits. So things to consider again, you still want to make sure that the most important providers, those providers that you know you're going to be seeing throughout the year, are contracted as part of that network. As far as seeking services outside of the network, are you comfortable paying those out-of-network charges? As I said, you're probably going to have a deductible. You're probably going to have to pay that percentage, which can be anywhere from 20, 30, 40% of those allowable charges. Again, do you travel frequently outside of the service area? Because if you're outside the service area, then you're pretty much in a position where, unless it's an emergency, you would have to be paying for those out-of-network charges. You also still want to make sure that your prescriptions are on the formulary for the drug coverage on that PPO plan. It's very, very important that you still keep in mind you got drugs that you're going to need to make sure are covered. Now, the third option that's available here in Oklahoma is the private fee-for-service plans. We don't see as many people that are enrolled in these as we do the HMO and the PPO option. They're a little bit more flexible than the other options. The beneficiary can see any provider that they want to see, provided that provider is willing to accept that insurance. The beneficiaries are responsible for making sure that the providers are willing to accept that private fee-for-service plan. Now, some of the private fee-for-service plans do have a contracted network now, but you still are responsible for making sure that the provider is willing to accept your insurance, and you have to do that each time you seek services. Even if they previously accepted that insurance, they don't necessarily have to accept it each time. And it can get very complex complex at times if the service that you're receiving involves multiple providers. We've had a couple of situations in the past where a beneficiary was possibly getting some sort of testing done that might involve not just a facility charge, but also a specialist charge. So you want to make sure you're getting all your bases covered in terms of making sure that the facility, the provider, possibly laboratory, that all these people, you've checked with all of them to make sure that they're going to accept your insurance. So again, a private fee-for-service plan can be a little more work on your side to make sure that everything is covered. Now, things to consider with the private fee-for-service plan. Again, will the providers that you're currently seeing agree to accept that plan? What will your out-of-pocket costs be? Are you comfortable having to have that conversation with these providers about accepting the plan? Now, with private fee-for-service plans, unlike the other Medicare Advantage plans, a lot of times they are structured so that you can get your own Part D drug plan separate from the private fee-for-service plan. The PPOs and the HMOs, they have their own drug coverage that's built into them. With the private fee-for-service plans, a lot of them you can get a separate Part D plan. Now, we've kind of gone over that nuts and bolts. Here's the structure, and here's what an HMO is, and here's what a PPO is, and all that good stuff. Now I want to talk a little bit more about the deeper dive into these plans and such. Kind of the things that people look at and are connecting to and I don't want to say pulled in by, but they are things that catch people's attention that can kind of be that they need to be aware of. Here's one of those. So, here's kind of the list. We've got the dental, vision, hearing, transportation, fitness, and then here's this last one, the flex card. These flex cards have become very popular in recent years because people could get them. They look just like a credit card. And over the course of the past few years, people have been using them to buy everything you can imagine. I mean, people were buying dog food, all sorts of stuff, fuel for their cars and things like that. Uh, Recently, CMS has reeled in what people are going to be allowed to spend on these flex cards. It's not going to be the catch-all that it has been in past years. They've gone back to where, for the most part, for most people who have the option of using these over-the-counter spending cards that they get from their HMO or PPO, they're going to be used specifically for over-the-counter medications, for those medications that are not prescription. Pain relievers, cold medications, things like that. Now, there is a group of Medicare beneficiaries who may be diagnosed with something that's called a special supplemental benefits for chronically ill, SSBCI. If you're one of the people that has been diagnosed with one of these specific illnesses, they have a more expanded list of things that they can use these cards for, like certain healthy foods, and maybe some other choices similar to that. But it's not going to be the catch-all that it was previously. They would have an identified list of things that they could spend it on, but it's no longer going to be the huge laundry list that it was before of everything under the sun. Now, some of the things as far as the diagnosis of people that could qualify for this SSBCI benefit, people with diabetes, chronic heart failure, dementia, ESRD, end-stage renal disease. That's just a few of them. There's actually quite a few more. And if you think that you might have a chronic condition that might be one of these conditions beyond just these four, talk to your doctor. It would require your doctor to fill out a letter, fill out a form that would be submitted to your managed care plan for them to qualify for you this, so that for you to be able to spend your flex card to use to buy more than just the over-the-counter drugs. So this would be something that you could talk to whoever you purchase your uh, uh, managed care plan from to learn more about that. Some more about these extra benefits. You really do not want to join a managed care plan for the extra benefits. I know it is very enticing, particularly if you've got a lot of dental problems, to think, I want to get on a managed care plan because it's got dental coverage. Dental coverage is incredibly important. I understand completely, and I think it's just as baffling to me and a lot of other people as to why you can get dental coverage on a Medicare Advantage plan, but you can't get it on regular Medicare. But be that as it may, if you are looking at a Medicare Advantage plan, make sure that you are basing your decision primarily on the medical coverage that it offers. As we said before, like the providers, the hospitals, look at your chronic conditions, not just on the extra benefits. If those extra benefits are important to you, if that dental coverage is important, then talk to your provider, talk to your dental provider. Ask them, do they accept that insurance? Whatever the insurance would be under that managed care plan, do they even accept it? Or would you have to find a different provider? Find out the limits of that dental coverage or that vision coverage. Is it going to achieve what you're trying to get to? Is there a specific procedure you're needing done, dental work done, that you're thinking that you're going to be able to get done with that? And how far will the dental benefit go? If the dental benefit is $2,000, $3,000, $4,000, whatever it might be, find out what the limits are, find out what the dental benefits are, and talk to your dentist and see how far that benefit will take you, because you might need to have other resources in place to finish up what you get started with that dental benefit if you decide to go that route. If your current providers are important to you, and I can tell you, I'm one of those big cowards that my dentist is very important to me. I don't like to go to the dentist. And so that relationship is very important to me. So I want to make sure that my dentist can accept whatever insurance that I have. So talk to them, ask what they do accept. If it's not that important to you and you're willing to go to other dentists, then that's not a big concern for you. The other thing you do want to pay attention to, though, is if you are going to have to go to another provider, where is that provider located? How far away are you going to have to go to see that provider? Maybe not that big of a deal if you live here in the metro area, but if you live in one of our rural communities, how far away is the next contracted provider to be able to use those extra benefits? Other things to consider with the managed care, Medicare Advantage plans. You may need to see if you have to use that contracted provider network. Who are those doctors and hospitals? How far do you have to drive to stay in network? In past years, we've seen some struggles between the managed care plans and hospital networks. Make sure that your local hospital, if that's important to you, make sure that not just your doctor is within network, but also if you want to be able to go to that hospital, is the hospital going to be a provider? Are you going to be able to go to that hospital for services other than emergency? Do your current providers have a good relationship with the plan you're considering? Something to keep in mind is a provider can be contracted with the plan. In the middle of the year, if there's some problem, if they get into some kind of dispute and they decide to terminate that contract, how quickly will that provider be able to get out of that contractual agreement with that plan? And if they can get out of that agreement, you can't necessarily do that. You may be stuck in that plan for the remainder of the year. How is that going to impact your care? So talk to the provider. They may have a great business relationship. They may be clicking on all fours and doing wonderful and just a very strong business relationship that works very, very well. And if that's the case, great. But if they're feeling like, well, we've had some issues and we're not doing so great or something, that might, be an important consideration for you before you take that leap. Are you comfortable getting prior authorizations? There are some people who are not very happy whenever their doctor says, I feel like you need to have this procedure done. They're not they don't like the idea of having to ask the insurance company about how they feel about it. So, that's something to think about. And again, we've already talked about this, traveling outside of the service area. Now, I want to touch on something else that popped up this year for those of us here in Oklahoma and in 5 other states, and that is the wasteful and inappropriate service reduction model. This kind of came out of the blue. I haven't found anybody that was really aware of this until it was just announced that it was occurring. This was a model that came down from CMS. Oklahoma is one of 6 states that are being hit with this. It is impacting traditional Medicare. And what they're doing is they're going to utilize AI, artificial intelligence, and they're going to use it to test a way to, in their words, expedite prior authorization processes for certain procedures. And what it is when a physician wants to do certain procedures on people who are enrolled in traditional Medicare, not people on Medicare Advantage plans. These are people just on straight Medicare A and B. Those requests are going to go through this artificial intelligence process. And if it meets all the right criteria, it will be approved by this artificial intelligence. If it doesn't meet the approval process, my understanding is it will be kicked out to be reviewed by a human being. So it will never be denied by AI. It would have to be denied by a human being. But this is the first foray of Medicare getting into the prior auth realm. And I think it's been very concerning to a lot of people. I don't know if anyone has heard some of this, but I know that AARP has come out very strongly against it and has said quite a bit about it. Some of the examples of the items and services that are going to be impacted by this here in Oklahoma: skin and tissue substitutes, implantation of electrical nerve stimulators, and knee arthroscopy for knee osteoarthritis. So if you find yourself in need of these services this year, you may be hearing more about this. Now, watch for any unexpected changes over the course of this year. Even after you have made your decisions and you think that you're all set for this year, you've decided whether or not you're going to enroll in a Medicare Advantage plan, or maybe you don't enroll in a Medicare Advantage plan and you select a Part D drug plan. Keep your eyes peeled. For some reason, we keep seeing people that say, I didn't enroll in this plan, but somehow I've gotten enrolled in it. I got a card, or I went to the doctor and the doctor said, well, you don't have the same insurance. Somehow you got enrolled in this. Keep your eyes open. Watch your Medicare summary notices. Look for any unexpected mail that you may have received that would any way indicate that something got changed in your insurance. There's some bad players out there. There's some people that we don't know what they're doing or why they're doing it, but they're getting people enrolled in coverage that either the people didn't understand what they were talking to somebody about, or somebody just got their information and enrolled them without telling them what they did. Watch your mail. Watch for any signs that would indicate that you somehow got enrolled in different insurance. If you see anything that looks weird, give us a call. Let us know as soon as possible. Don't put it off. The sooner that we can report these things, the easier it is for us to help you get it fixed. You want to make sure that the right people know your insurance information. If you have made a change, if you've changed to a Medicare Advantage plan, or if you've changed to a different Medicare Advantage plan or a Medicare supplement plan or something like that, get that information to your medical providers. Also, make a family member aware of it. If something, God forbid, were to happen and you were in an accident unexpectedly, which accidents would be, those people need to be aware of it so that when you're at the hospital, maybe you're unconscious and you're not able to communicate with people. These are the people that can represent you and that can speak to people and make them aware of what your coverage is. Always keep accurate records. Your current information, as far as if you're a retiree, maybe you've got military coverage, anything like that. Who the current providers are that know the important information about you. Maybe you've got a history of cancer or a heart condition. Those people can be critical knowledge holders in a time of emergency. Your current medications also very, very important, especially when there's an emergency or any health conditions. If you've got a situation like that, here is a great way for you to keep that information and keep it current. If you would like a copy of a healthcare journal, we give these out for free. You can go to this website or you can just give us a call at 1-800-763-2828, and we would be happy to send you one of these healthcare journals. So that you can keep track of who your providers are, your doctor's appointments, your health history, your current medications, all of that kind of information. Now, here's some resources. We always want you to give us a call if you can. I don't know why I took the phone number off of there. It might show up on the next click, but I don't want to click this unless I know for a fact it's going to. Our phone number again is 1-800-763-2828. You can also call 1-800-Medicare, but folks, I will tell you, this time of year, they are so incredibly busy with open enrollment and everything. And then, of course, with the government shutdown, that hasn't done anybody any favors. So, you can certainly call them, though they are still functioning. I don't want to give you the impression that they've closed down or anything like that. No. Medicare, CMS, Social Security, all of those folks are still working. But they are very, very busy. Also talking to a local insurance agent. I always want to encourage people, if you're going to talk to somebody about an insurance product, it's always a great idea to talk to somebody local, somebody face to face, somebody that you know is going to be there the next time you need to talk to them about that product. And I'm talking about whether you're talking health insurance, homeowners insurance, anything like that. Medicare.gov is an awesome website, folks. Great information. That's where we go as counselors to help people do their comparisons for their drug coverage, their health coverage, all of that stuff. And as I said at the beginning of the presentation, the provider network information is available on that website now. So if you want to know if the doctors are covered by a specific Medicare Advantage plan, that information is included there now. So feel free to go on there and check it out. This is the list of the agencies around the state that we contract with that provide the same counseling that we do. So if you live in one of these counties and you would like to talk to someone at one of those agencies, feel free to do so. They are happy to help you. And they can talk to you about any of the same stuff that we do. If you ask them a question that they're not comfortable with or don't know the answer to, hey, they'll give us a call. So they are there and happy to help you. All right, questions. I know we're a little bit over.
It looks like we do not have questions. Oh wait, hang on. We just had one come in. Let's see. Okay, this person says, I have family members who ask about these mail and YouTube offers that come about getting a free $2,500 gift card for groceries. I tell them not to accept as it may be a fraud attempt to get them to change their Medicare or Advantage plan without their permission. We heard anything about that specific scam, Ray?
I think that is the best advice in the world because let's play this out. Okay, let's say that it's a $2,500 gift card to get them to switch their insurance. How far would $2,500 go in terms of medical costs? Not very far. And that's scary when you think about it. 2,500 bucks. So you're right. It's not a really good idea. I would love to see if someone sees something like that, give us a call, turn that in, send it to us in an email. That would be awesome because we always love to follow up on those and keep track of them and turn those in as well, because that's not a good thing. But no, you're right. It's not a good idea for somebody to go on a plan just for that reason. There are some of the Medicare Advantage plans that also offer what they call a Part B buyback. That means they will pay part of your Part B monthly premium. And that might be of help to some people, as long as the other benefits work for you as well. Medicare Advantage plans aren't necessarily a bad thing. For some people, they're a great thing, and they work very well because those people know how to work within a Medicare Advantage system. And so go for it, work with the system, and their hospital, their providers, all of those things are working together, and work very effective for them. If you look in some of the markets out there in California and Florida and places like that, those things work very well. What you have to be very, very cognizant of and very aware of is where you are and who you are. None of us are all the same. And that's what I'm trying to emphasize. I don't want to give anyone the impression that we're saying Medicare Advantage plans are bad or Medicare Advantage plans are good. Medicare Advantage plans are just one of the options that are out there for Medicare beneficiaries to get their medical care. And there's other options out there. This is just one of them, and we want you to know the pros and the cons.
It looks like that's all the questions we have today, Ray.
Okay. Folks, thank you so much for joining us. I hope that everybody takes advantage of this time of year and that you will definitely, uh, you know, go out there, talk to a counselor, talk to an insurance agent, get the information you need, make sure you've got the coverage that you need. You've got till December 7th, folks. Uh, get all your ducks in a row, get your coverage situated. If you have any questions, give us a call. Our phones have been very, very busy, but please be patient with us. If you do call us and our phones are busy, it gives you an option to leave your phone number. We will call you back, I promise. So you guys have a great week, and we will talk to you next month.